Hi, how are you today? I'm doing pretty good myself and hoping that you are finding solutions for your fibromyalgia. I wanted to go over some, a really big, extensive list of fibromyalgia symptoms. I need to open it up. If you would go to um, fibromyalgiatreatment.com, you will find this list. Treatment. And what is fibromyalgia? Um, this is the website that can offer some support for the Guaifenesin protocol. And what Guaifenesin does for people with fibromyalgia is help the kidneys get rid of the excess oxalates that are in the body causing the fibro problems. It's a slower process than carnivore. However, if you're not quite ready to give up your plants, at least consider what a low oxalate diet would be and follow this protocol. It worked great for me up until menopause, and then I had weight gain that was really horrendous, which led me to finding carnivore eventually. It took a long time, like 6 years after menopause and 190 pounds to decide I really needed something drastic, and discovered the carnivore diet and changed my life. And I even feel better now than I did when I was on the Guaifenesin protocol. But I highly recommend the Guaifenesin protocol. It does aid in ridding the body of oxalates. Here's some things that are said. Let's see. I want to be able to place my picture right here. Fibromyalgia is a legitimate, maybe I'll go like this. Here we go. I'll take a picture of this and put it in there. Fibromyalgia is a legitimate common entity. It is cyclic and progressive. It affects millions of patients, primarily women. Patients feel more symptoms and get sicker over time. This is probably where you're at in life, wondering, why me? Why do I have to deal with this? I'm tired of dealing with this. I'm sick and tired of being sick and tired. So I want to encourage you to follow the Guaifenesin protocol. There's no diagnostic laboratory test for fibromyalgia. It is called a syndrome, meaning it is distinguished by a collection of symptoms. So let's go over these symptoms. These symptoms do not go away even after sleep. Maybe they'll be alleviated with some pain medication like Aleve. I know that I cannot tolerate Tylenol. Excedrin's a huge no. Aleve is my go-to girl. And let's see, before going on the Guaifenesin protocol, I probably took 2 Aleve twice a day and then Benadryl at night to help me sleep because I had migraines like no other. So let's go over some of these symptoms. I'll have this up as well. So the central nervous system: fatigue, irritability, nervousness, depression, apathy, listlessness, impaired memory, concentration, anxieties, suicidal thoughts, insomnia, frequent awakening due to pain, uh, resulting in non-restorative sleep. So I would say I did not have any suicidal tendencies. However, there are members of my family who do, and I pray for them that they can find some peace. They don't experience fibromyalgia, but they do experience anxiety. So that can be other mental incapacities that they are struggling with, and I'm wondering if they went carnivore, if they would be relieved of that as well. That's something I believe. I do have a tendency to spiral in my thinking. So mainly, if you don't know what spiraling is, one thought leads to another and to another and to another, and then you just go in like a circular motion with those thoughts and never get out, like a whirlwind or like a whirlpool that you just sink into further and further into your thoughts. And I think a lot of times people start that way and end up with, oh, I said the word and I wonder if Facebook will flag me. Oh dear. They have so many rules. Having these thoughts to end life. If you are feeling this way, please know that there's hope for you and you can get out of this cycle. I found that taking the Guaifenesin did help a lot with my emotional ups and downs. However, not nearly as well as a high-fat carnivore diet. There was a period of time right before a complete reversal where I had the darkest spiraling of my own, but still not. I'm very stubborn. I want to live forever. I'm very stubborn about that. But the despondency was almost unbearable. And then, I just kept eating the fat, kept eating carnivore, kept eating more fat, kept eating carnivore, kept eating more fat. And then finally just popped right out of it. I also did a deep dive. A lot of times when I feel this way, I'll do a deep dive either in journaling or reading the Bible and prayer. This time around, I did reading the Bible and prayer, and I got relief finally. And I have not had to look back. Now, when I ate fun food over the holidays, I did start to get more emotional. But as soon as I went back to eating carnivore this month, I have been for the past 15 days very stable in my emotions. Wait, it wasn't 15. Was it 15 days? No, because I went back to work after January 4th. So it's a little bit about more like 10, 11, 12 days or so. I would say that either the 4th or the 5th, I got back into eating carnivores. Very strict. So I am feeling very stabilized right now, but I do remember all those crying fests, and just going in the former house I lived in. We had a walk-in closet, and I spent a lot of time in there crying because I did not want my kids to see me crying. I did not want my former spouse to see me crying. And it was a miserable time in my life, having the most fibromyalgic symptoms ever. These oxalates will lodge in the brain tissue and cause these problems. So if they can cause problems for fibromyalgia, I bet you they can cause problems for other people as well. Um, when they come out of your body with the Guaifenesin protocol or with carnivore, it does cause pain, it does cause some trauma, um, and you do got to be pretty careful about it. But what I have found is that the trauma and the pain of them coming out of the body, the end result is by far worth it. So, um, as far as other symptoms, musculoskeletal, I can't say that. Can you say that? Musculoskeletal. Pain is generalized morning stiffness. Now, I will admit, I still have morning stiffness for real. And that's just the, the reality of my life every day, getting up, feeling stiff. And I don't know exactly why that happens. I do wake up several times during the night and try to get back to sleep. I tested eating butter in the middle of the night, and I actually started improving my sleep. I don't like doing that, obviously, because I only did that a couple of days in a row. But it is something I would like to get back into doing because I would like to have restorative sleep. But yeah, generalized stiffness. I'm thinking that's related to glucose. So even if you're not consuming glucose, like carbohydrates, that's glucose. Typically, what you would get from eating grains and potatoes and sweets, um, even fruit and vegetable have small amounts of glucose in them. Somehow I don't know, somehow that can add to that pain and stiffness that you feel in the morning. Movement actually relieves that. So I have an app from work that I do. It's called Hinge. And if your job offers Hinge, I highly recommend that you follow it. Give them the location of the most pain in your body so they can put together a routine for you that works. And just start the morning with some small movements and and move around. Help get that stiffness moving. I said moving a lot, didn't I? Other musculoskeletal pain. This morning stiffness could arise from muscles, tendons, ligaments, fascia of the shoulders, neck, entire back, hip, thighs, knees, ankles, feet, inner, outer, elbows, wrists, fingers, and chest. Injured or old operative sites are commonly affected, though fibromyalgia is described as non articular disease may many know better. A non-articular disease, I'm not really sure what that means. I wonder if that means that it's not related to the arteries or whatever, like whatever would cause stiffness, I guess. I don't know. I'll look that up. Joint pains with or without swelling, redness, and heat are frequent. The litany includes foot or calf cramps, numbness, tingling of the face or extremities. So I didn't really have a lot of leg cramps, but I did have a lot of leg stiffness. And nowadays it's just more of it is for me neck, shoulder, and feet and ankles. So I do a lot of ankle rotations, and I do a lot of neck exercises to help loosen that up. It's very stiff. For personal reasons, I do not do the chiropractor anymore. I know a lot of people get relief from it. I do get a lot of relief from the hinge exercises as long as I'm consistent with it. This year, I will be working very hard on consistency. It's very important to me. I lack it in a big way, and trying to find new habits to form is just an incredible, unsurmountable amount of work for me. Could have something to do with ADD, ADHD, whatever. I'm one of those, undiagnosed, self-diagnosed kind of people. I did finally get a diagnosis for fibromyalgia, but I suspected it for a really long time. When you have this mystery pain and fatigue starting in your late 20s, early 30s, and you just don't know what it could be. Sometimes it just takes a friend to say, well, have you thought about fibromyalgia? Let's go over some more of these symptoms. Irritable bowel. How many of you have this problem? Often called leaky gut, spastic colon, or mucous colitis. Symptoms include nausea, often brief, repetitive waves of nausea, indigestion, gas, bloating, pain, cramps, constipation, alternating with diarrhea, and sometimes mucus stools. Guaifenesin did not heal all of my IBS, but it did heal a huge portion of it. And before I hit menopause, I ate anything I wanted, and I could exercise and work off the extra weight. After menopause, what's going on with menopause? After menopause, it was a whole new game. I could not stop craving carbohydrates. And if I limited myself to small portions and try to do the keto diet or something similar to that, just a small portion of carbohydrates made me hungry. I could not satisfy my hunger even with a stretched belly full of food. Of course, this ended in gaining a lot of weight and inflammation, and my fibromyalgia symptoms coming back, even though I was on the Guaifenesin protocol. I was desperate for a change, and when I finally found carnivore, I got the change I was desperate for. So I have zero issues with my gut. Even if I do eat fun, I call it fun food. That's probably a bad idea, but I call it fun food. I mean, berries taste delicious, right? Vegetables, not so much, but grains are amazing. Potatoes, oh my gosh, that's fun food, okay? I recognize that. But, and I don't get the bloating anymore or the pain or the nausea anymore. I don't get the cravings for it anymore. Even if I have a small amount, I'm okay. I can have a small bite and not crave it at all. There's something about meat and fat from the animal source that satisfies everything that your body needs. I just find that to be just this miracle that I happened to stumble upon, and I am so glad I did because I was looking for answers, and I think I found one. All right, genitourinary. Genitourinary. I should have practiced these words before starting this video, but I just want to be, genuine and live in everything I do on YouTube. I don't want to be perfect. Why be perfect? Common are pungent urine. This sounds really gross. Frequent urination. Bladder spasms. I don't know what that feels like. Do you know what that feels like? Burning urination, dysuria, with or without repeated bladder infections, and interstitial cystitis. That sounds like cysts inside the urinary tract. That sounds really painful. As women, we can get a lot of what we call female problems that men don't seem to get so much. And bladder infections are like one of the number one things. So I'm always so careful to be clean. So careful to be clean because that is the most painful thing to ever happen. I think the worst thing that's happened to me with carnivore is it felt like my kidneys had kidney stones coming out, and then I bled a little bit, and then that was it. Nothing else. So I never have these issues anymore. But I had them 3 or 4 times a year before I started the Guaifenesin protocol. So, okay, this is a woman thing. Vulvodynia, that's vulvar pain syndrome. That's a pretty strong, powerful fibromyalgia symptom that most likely is related to oxalates. And let's see, do you eat a lot of chocolate? Do you eat a lot of spinach? Do you consume a lot of almond products like almond milk, almond flour, or almond things made with almonds, or just eat almonds, or things with almonds in them? Almonds are very high in oxalates. Chocolate is very high in oxalates. Spices are high in oxalates, some more than others. Tea. Do you drink a lot of tea? Tea is extraordinarily high in oxalates in concentrated amounts. Do you drink vegetable smoothies, especially with leafy green vegetables? That is super high in oxalates. thinking that it's healthy for you and could be causing more and more problems and buildup. So, learning how to get rid of oxalates is a real challenge. You want to go online and find the list of high oxalate food and eliminate the ones that are really high, eat the ones that are really low oxalate. And you might find improvement in that. So, guys out there, if your wives/girlfriends are complaining about how painful it is to be intimate with you, it's not because she don't love you. It's because she feels the kind of pain that no one in this world should ever have to feel. So that's enough of that. It typically mimics a yeast infection, but doesn't have the gross discharge. That's for sure. That's for sure. Yeah, that's just. And intense PMS. You thought that it was normal to go 10 days with a period and just have bloating and cramping and the most uncomfortable first 3 days of your period. And guess what? That's not normal and healthy. I don't care what the doctor tells you. Let's see. So, during my growing up years, I had terrible PMS and face breaking out, really bad acne. Then I went to a bio-nutritionist, which he has since passed away, and I don't know what his son is doing as far as that. He worked a miracle in my life, gave me some supplements that had to do with bovine hormones, and within 30 days, my PMS was completely gone, and so was all the acne. Now, he based this on a complete blood panel. Doctors don't normally do that because insurance companies don't pay for it. I don't know what my dad paid for it, but he paid for it, and it was fabulous. He said that after having a pregnancy, each time my hormones would change a little bit and everything, but everything should be really good and safe for getting pregnant and all that. So I did. I had 3 beautiful, healthy kids. And then things did change for me, and I didn't understand it, and my husband didn't understand it. So, um, you know, there go I into the world of I don't know what to do with my life. This is not good. So, um, Guaifenesin helped a lot with calming that down a little bit and brought back some more pain-free. And boy, I'm being really personal, aren't I? I'm just saying that um, these oxalates are terrible little things. They look like glass shards under the microscope, so that's pretty much why they're so terrible. And for some reason, the body stores them. If your kidneys can't eliminate them, the body just stores them. I don't know why the body just doesn't excrete them. Why does it store them all over the place? And it's not until you stop eating oxalates that all of a sudden they all come out. I call that oxalate dumping. The Guaifenesin protocol helps to do that in small bits, so it's not so drastic. I think that's one of the major benefits to the protocol. Let's see. Dermatological. Do you have any of these symptoms? Various rashes with or without itching? Wondering why all of a sudden you have a rash for no reason. I usually would get a breakout rash after using certain kinds of soap or shampoo. It was one way to know if my jewelry had nickel in it. So I would know if my jewelry was fake. My son should not get personal with them. Okay, we'll just forget that. Diaper rashes. I wonder, I wonder if do your babies have more rashes after eating vegetables? Or, do you notice a difference? Do you notice a difference in their diaper if you just give them, they don't like meat in the baby food jar. You know what they'll like though? They'll like the processed fresh meat that you make. You're making chicken dinner, then process the meat and fat in for the baby to eat easier without choking on anything. And see how that helps. You might have a couple of days of rashes just because of if the oxalates are the reason for them. I'm not saying that they are, but if they are, but there's so many people in this world telling you what's healthy, what's not healthy. We just changed the food pyramid for the last however many years. They've been telling us that we should have mostly grain. Now we've got all kinds of diseases. And the new guy in town is saying, no, we should have mostly meat and fat. Well, he looks really super healthy and fit. I mean, he does a lot of pull-ups and push-ups. I can't do that. So he might, he might have some wisdom as far as what's really good for the body. But in spite of that, when we talk about children's health, you have to decide for yourself what's best for your kids. And there are a lot of families on carnivore who find that their kids are doing great with it. So they kind of do more of the keto thing so that they still have fruit and such. But anyway, I was just curious if anybody notices diaper rashes being worse after certain kinds of food. So something to look into. Let's see. Hives, red blotches, itchy bumps, blisters, eczema, seborrheic or neurodermatitis, rosacea, nails often brittle, poor quality, hair falls out prematurely, strange sensations, common such as cold heat, especially palms, soles, thighs, crawling, electric vibrations, prickling, super sensitivity to touch. Ooh, that was the big one for me. Just touching me like this, gently, felt like someone was bruising me, or that I had bruises. I was so sensitive to it. Let's see. That crawling electric vibration, you ever go, it was actually an itch that I kept chasing. You ever go, okay, I got an itch here. And so, well, why do I have an itch back? And now I got an itch here, and what's going on? Now my ears itch. My leg's itching. What's going on with it? It's like everywhere all of a sudden. Crazy thing. It could be the body is trying to excrete those oxalates, but not having a whole lot of success with it. Um, this sounds like it's more about a oxalate toxicity than it is about fibromyalgia. I'm just saying these could be some of the reasons why this is happening. It's not set in stone, but it is typical for oxalate dumping to have these same exact symptoms when getting rid of oxalate. So it's interesting how they correlate. Once they're once they're gone, the majority of them are gone. A lot of these symptoms you're just relieved of. You don't experience anymore, and you get more energy because you're not bogged down by the stress of them. Let's see. Head, eye, ear, nose, and throat. Headaches or migraines, dizziness, vertigo, imbalance, dry eyes, as well as itching and burning, with or without sticky or crusty discharge upon awakening. Yeah, I mean, so all of that. And then with the Guaifenesin protocol, less of it, but still happening. And then, I mean, it was such to the point that I just gave up using contacts. And I've been wearing glasses for the last, I think, 20 years now, probably, or more. I don't know. I'd have to look. It was just a pain to be using contacts. They hurt more. Okay. Wearing the contacts, they just hurt more. I felt like I had gritty sand in my eyes all the time. Something I noticed when dumping oxalates, like second or third month into carnivore, all of a sudden I had all these symptoms, and it was excruciating, burning eyes and feeling like there was sand in them. And when I looked up what these symptoms were, it made complete sense to me. And so I just had to grin through it, I guess. Use those eye drops. The eye drops helped out a lot, and Epsom salt baths, and just splashing the Epsom salt water over my eyes and face, like with my eyes closed, of course. And then, yeah, I mean, that these symptoms sound like these are oxalates, and your body is trying to get rid of them, but not in a not in an aggressive manner, just whatever it can, whenever it can. And maybe it's, you're experiencing this after eating different kinds of foods that did not have high oxalates. I don't know. I mean, you'd want to keep a food journal to find out, when do these symptoms occur, and after what kind of food I eat, and when does this happen to me? Let's see. Blurred vision, nasal congestion, postnasal drip, painful burning tongue, mouth, abnormal taste, scalded, bad or metallic, ringing in the ears, lower pitch sounds, ear and eyeball pain, sensitivity to light, sounds, and odors. So, I have tinnitus. That has not gone away since starting carnivore or the Guaifenesin protocol. It's still there. That hasn't changed. I don't even think it's less. And I don't know if there's any way to really heal the tinnitus. I was going to try fasting to see if it would get rid of the tinnitus. Oh, sorry, it's been a long day. But fasting. Fasting what? All food? Is just butter okay? I've done that before for a couple of days in a row, and that worked out really well. Felt amazing. The more I don't eat, the more amazing I feel, which tells me something is wrong with how I process food. So there you have it. What does the doctor say? Oh, I don't know. I'll ask them tomorrow what they think, because I'm going in tomorrow and I'd like them just to have a discussion about that kind of stuff. So we'll see what happens. As far as sensitivity to light, sounds, and odors, I still have sensitivities to those things, but not as extreme as before. So, is it ADD or is it glucose? Is it ADD? Let's see. Is it fibromyalgia or is it glucose? I don't know. Because your liver can make glucose whenever it wants to use glucose for energy. You don't have to eat carbohydrates, they're completely unnecessary. But when your body's been in ketosis for a while, which I'm pretty sure I'm in ketosis right now, I mean, you can't tell that I have fibromyalgia. I don't act like someone with fibromyalgia. I'm trying to think. I wake up really groggy in the morning and stiff, and that's when I think my body makes glucose to wake me up. And that's pretty typical if I wake up several times during the night. So, there's there is something metabolically going on with us with our fibromyalgia, and it would be really nice if doctors took nutrition seriously, and if somebody would just do a study on this. You know, the carnivore diet for people with fibromyalgia. What are oxalates? How does glucose? Why? You know, why is it hard for us to process sugar? Why is it hard for us to process oxalates out of food? Why is this a struggle for us more than other people? What's actually going on with us? Here's a fun one: miscellaneous symptoms. And I will say, yes, even on the Guaifenesin protocol, I had a lot more stuffiness and postnasal drip than I do now. Now that I'm on carnivore, a lot of that is relieved. So I think what's going on is the body is using that mucus to clean toxins out of it. So that's how I see that. All right. Miscellaneous symptoms. Weight gain. Holy cow. So I would love to try to get back to 120 pounds. I'm 30 pounds away. 35, actually. 35 pounds away. Is it going to happen? Before menopause, I was 150 pounds. So I don't know that it will. Maybe I just have to exercise more. What do you think? Probably. Low grade fever. You know, I walked around like with 99 fever all the time until I started the Guaifenesin protocol, and then that went back down to normal. I always thought I was fighting something off, you know. Could be Epstein-Barr, but it just felt like that. And then when I really got sick, you know, they give you an antibiotic or antiviral if you catch it in the very beginning stages. And I felt amazing after taking those. So that was some kind of indication for me that there is something going on here that that really bogs me down. Now, I take Lysine daily, and I have noticed that I don't get sick with colds and flus anymore, and that many of my allergy symptoms have subsided a tremendous amount. So it could be that, or it could be eating carnivore and not plants, or, you know, it could be a gazillion things. So I would just say those things have pretty much gone away. I just have a very small amount of sinus issue that's annoying enough, but not really giving me a lot of problem. Lowered immunity to infections. Yeah, I got sick a lot. Morning eyelid and hand swelling from fluid retention that gravitates to the lower extremities by evening, where it stretches tissues, causing restless leg syndrome. Anybody have that? Anybody have restless leg syndrome? I used to, and I didn't know why. And I don't think I've had any issues with that since I started the Guaifenesin protocol. So that was a relief. Waking up in the morning to have really puffy eyes and look like I'm some kind of dang turtle. I still have a little bit of that when I wake up in the morning. Generally, a shower and a nice glass of water relieves me of that. Probably coffee does too, I don't know. Only a couple of times in my adulthood have my feet and ankles swollen up. I don't get that so much. I feel pretty lucky about that. Let's see, the hypoglycemia syndrome. This is a really important one to talk about. I did not believe I had an issue with sugar until I started carnivore and realized that was my issue. This is a separate entity. 30% of female and 20% of male fibromyalgics suffer both conditions, fibroglycemia. Symptoms greatly overlap those of fibromyalgia, but sugar craving, accompanied by tremors, sweating, anxiety, panic attacks, heart pounding, faintness, frontal headaches, especially if hunger induced, are solid clues to the diagnosis. Hypoglycemics must follow a prescribed diet, or recovery will not be complete, even with the reversal of fibromyalgia. So, I would 100% thoroughly agree with them on this. The glucose in the blood, if the body is not processing it correctly, then eventually continuing on in the high carb diet that you have can turn into diabetes type 2 or even type 3 dementia. Fibromyalgia can get progressive over time if you do nothing. what I encourage you to do is do something and find answers. If you decide to go the Guaifenesin route, you'll want to get the book What Your Doctor May Not Tell You About Fibromyalgia. It clearly states what fibromyalgia is, how Dr. Sanamon came about using Guaifenesin, and all the tests that he did and his conclusions on that. And then, of course, one of the things you've got to be careful of is, well, in conjunction with it, I would say eat a low oxalate diet, and that will help you with eating a low salicylic acid diet. Salicylic acid is another compound in plants that plants use to protect themselves from being eaten. But what do we do as humans? We grab them, we tear them apart, we squeeze out the juice and oil from them, and then we put that on our skin. Full of salicylic acid, that will go straight through the skin barrier and directly into the bloodstream. We know this is possible because any particle medication that you put on your body will go straight through because the particle is small enough. Sorry, I got this long hair in my sleeve. So it's important that you go through everything in your household that has plant oils or plant juices in them as an ingredient and get rid of all of them before you start the Guaifenesin protocol. Mainly because you need to get used to not using those anymore. And number two, you'll see that a lot of your symptoms start alleviating after doing that. I found that to be one of the biggest surprises is getting rid of all those products I was using. And I went to Pantene, and that's what I use for my hair and body. I like the smell of Pantene. And then I started using less makeup. I did not like the Dollar Tree makeup at all. And it just developed into, like, I'm not wearing any makeup today. I don't. I generally will use something on my eyelashes, and that's it. I don't like the feel of makeup. I usually have a reaction to it, so that I've just been used to doing that. Yeah, and then you gotta stop drinking tea if you want to do the Guaifenesin protocol. And you really need to give it a 90-day trial to start to see the patterns and improvement. You've got to, the book describes getting a mapping done. I don't know of anybody who does that. Basically, when you run your hand along your skin, you might feel what we call lesions. They're like little supple bumps just underneath the skin surface in different parts. And there is a mapping diagram where if you want to copy that or something, then you can record, well, how large is this lesion in my body? And three months later, you do it again and you feel for them and go, well, gee, is that there anymore? Where did that one go? Now, if it's a hard solid mass, that's not a lesion, that's a fat conglomerate thing or whatever doctors call them. those don't dissipate or go away. Some of you might have super sensitive elbows. I am one of those, and I have these things here in my elbow. Super sensitive. I am still super sensitive in my elbows. What else? I believe there's a chart in the book also that shows like those circle diagrams of, well, this is glycemic, whatever syndrome, and then this is fibromyalgia. But the two circles together, these are the symptoms that both fibromyalgia and glycemic syndrome have. That's a really interesting one. To go through and let's see, which one are my symptoms? And then you circle all the ones that are your symptoms. And then 90 days later, you do it again and you go, what symptoms am I feeling today? And then compare the two charts. And if you see improvement, the Guaifenesin's working. So it's completely harmless. Your doctor will say it'll probably have a placebo effect, but let me tell you, there's no placebo effect for IBS. Okay? Right? Excuse me, doctor, a placebo effect for my IBS? Come on. Cut it out. What else? Leg cramps? Yeah, no. Things that are involuntary, right? Or maybe your thought pattern will start to become more happier, right? Because you're not in nearly as much pain. On my next video, I think I will definitely go through what a food journal, a fibromyalgia journal is that I keep, that I used to keep. If I happen to find my old journal, which I'd kind of like to do to show it to you. It's just one of those little notebooks that your kid's teacher says you got to go get so they can do their writing assignment in it. Whatever. So, wow, this is a real extensive list. There's a lot of stuff going on. Take care of yourself. Why don't you take an Epsom salt bath? It'll relieve a lot. If your feet are burning after you get out of that nice hot bath, it's the oxalates that the Epsom salt is helping to draw out of the body. Let your body feel that way. I remember how painful and itchy they were. It annoyed me, and it made me not want to do it again. But once I realized what it was, I don't have that sensation anymore. And I think that's because the oxalates are mostly gone. I think I might have a few stubborn ones in my joints. Maybe only fasting will help me with that. Also, taking excessive amounts of vitamin C causes your body to make oxalates. So you won't need vitamin C. You don't need to take that at all. You're not going to get scurvy. Especially if you decide to go carnivore diet. Actually, your gingivitis will go away. And you're not going to get scurvy. Meat has a very minuscule amount of vitamin C, but apparently it's enough. Because we're not eating plants, we're not overloading our body with excess whatever, causing the body to retain water and fat. So I don't know. It's when the oxalates go away, so do a lot of other things that just kind of surprise you, like body odor and healthy teeth. So All right. What can I tell you that would be encouraging and lift you up? Enjoy the nature around you. You are surrounded by a world full of beauty, and find a way tomorrow to get outside and enjoy it. And maybe I'll do that too. Have a good night, and hope this finds you doing well. Bye for now.